We know from the Middle East that there are probably a large number of, well, who knows how many.
Now, in terms of the outbreak, this is the largest outbreak of MERS covirus infection that has occurred outside of the Middle East. And as of today, the outbreak in the Republic of Korea has resulted in 162 cases of infections, and there have been 19 deaths which have been officially reported. And currently there are over 6,500 people who are under monitoring as contacts of these cases. But overall, there have been over 10,000 people who have been monitored since the start of the outbreak, so it's quite large numbers. Again, what we can say is that when we look at the pattern of new cases, not old cases, but new cases occurring now, we see that they appear to be going down. And so when we look at the control measures which have been instituted and we begin to see the decline in new cases, we think that it's likely that there is an effect there of the control measures. However, I do want to be cautious here because, again, we really can't predict the future. And so one of the main points that we made in our discussions with the government is that it is absolutely critical to keep up high levels of surveillance, keep up high levels of monitoring until we know that transmission is ended and the outbreak is over.
In asymptomatic people, and that
the emergency committee unanimously agreed that the current situation was of concern, but that it did not constitute a public health emergency of international concern. This was transmitted to the Director General, and she has agreed with their guidance.